welcome to our Digital Workforce Summit. I trust at the end of this you'll have a very rewarding experience in your mind about what you've learned today. It's interesting, I've been here about a year. I came a year ago to IPSoft. I had a startup, I'm a serial entrepreneur, and I wanted to license Amelia. And I met Chayton, and I met Jonathan Crane and Chris Reardon, and saw passion and vision and intellect and business acumen. And they invited me to come inside and be entrepreneurial on the inside of the company rather than be on the outside, and that was a good decision. I'm very fortunate. I'm the envy of my physician friends in my professional life. It's really challenging and rewarding as we solve complex problems within the healthcare vertical's triad of business, information technology, and clinical domains. More importantly, though, I'm very blessed. I have a very supportive group of friends and family and coworkers. I'm a cancer survivor. And I see our company's assets, such as Amelia, as playing a pivotal role in defeating and dealing with this scourge of humanity. Now, concerning my work, part of my week is devoted to actual clinical care. I work in a large clinic in Newark, New Jersey, just across the river, and we deliver care in a family practice setting to the medically and economically disadvantaged. This also involves doing house calls. And if you really want to think about a very interesting environment to deliver care in 2019, delivering house calls to the inner city is challenging and interesting. Now, I spend the bulk of my time at IPSoft taking advantage of this clinical experience and designing integrated use cases positioned to decrease the cost of care, improve clinical outcomes, and increase patient satisfaction. Now, in my opinion, the fruits of this labor will help drive the global decentralization of healthcare delivery and empower the next generation of business ecosystems. Now, as we know, businesses demand, and the global demand for the efficient and effective delivery of care is projected to grow substantially, so long as we don't introduce inhumane and draconian rationing models, then that could be a problem. So let's look at some of the drivers before I introduce our distinguished panel. If you think about diabetes now, unfortunately in this room, there's probably a cohort of people. If there's 400 people in here, at least 40 of you have diabetes. Maybe 125 of us have prediabetes. But we're going to be spending about $600 billion by 2030 in the care of patients with diabetes in the US alone. Cardiovascular disease is rampant. We'll probably spend about $1 trillion or more globally by 2030, half of it in the delivery of care, the other half in lost productivity. Now, healthcare delivery is undergoing a revolution. It's becoming decentralized. What do I mean by that? In the old days, you would travel from your home to the hospital, to the clinic. And now you're traveling less to the center, and we're taking technology and our clinical experience out to the home. A house call with a mobile component to it is a decentralized delivery of care. And if you think about, and you take a look at the domains and ecosystems around this model, I'm doing house calls, physician house calls at the bottom, this home monitoring, we have visiting nurses going to our homes, home physical therapy. There are retail clinics that have been deployed. A lot of companies have clinics actually in their location for employees to use rather than taking the day off to go to the doctor. So this is an evolution, and it's driven by many forces. Ubiquitous telecommunications, high-speed bandwidth at a low cost, cloud computing, etc. So this is the space we live in, and certainly AI will play a role in this. Now, mobile health's impact over the next 5 years is going to be rather significant. We've been using mobile health for a long time, the technologies that empower this. And I think you'll start to see, we'll be deploying video phones within some of the federal housing in Newark that I'm working in. And you wouldn't have thought that you would have video phones in the inner city and the disadvantaged would be able to take care of that. But what lays within that? What manages all that? You heard the excellent introduction by Chayton. There's a whole layer of AI and automation that's required to really orchestrate this correctly. And lastly, before I introduce the panel, this is a recent graphic from Accenture where they consider AI to be the new nervous system of healthcare. You know, I understand what that means. I think we'll all start to really see that. From an entrepreneurial perspective, the healthcare AI market by 2021 may have about $7 billion invested in it. There's a lot of money going into AI startups. And on the right, you see a potpourri of applications, the buckets, the categories, that they feel will generate about $150 billion of churn will go into that. Things like virtual nursing assistants. So in my practice, I see a lot of patients. I need virtual assistants to help me care for the patients that are in our ecosystem. Those of you, may not understand capitated models, but some of our plans pay the office about $200 for the whole year to deliver care. So if you see that patient 5 or 6 or 7 times, right, you can't run your business, so you do need a digital workforce to help you with that. So this is a very interesting space, and we're all going to be part of this, and the company is going to be a leading driver in it. So without further ado, I'd like to introduce our panel. Come up to the stage, please. We have Kathleen McFetridge from McKesson. We have Merin Joseph, our CIO from Westmed. Dr. Suman is a consultant and physician technologist from NTT Data Services. And Andrew Richardson flew in from Australia. He has a very interesting company, The House with No Steps. And they all 4 represent different parts of this ecosystem, and we're looking forward to chatting. You have the... So our topic is the use of AI within the global healthcare community, right, as we're decentralizing and deploying, and we all have different perspectives. Dr. Suman, I know you're doing very cool things within the IT backend, the data lake space, the integration space. Do you have any comments for us?
So, absolutely, and I really appreciate the presentation that you did. It very much resonates that where healthcare is moving today. I would like to call out 2 things from my perspective. I definitely made a career transition. I am a physician. I work with World Health Organization, and then made up my mind to do something more transformative, and that's what I picked up healthcare IT as one of my choice. So from a physician perspective, what I strongly believe is we never did true healthcare. We always tried to do sick care. We always try to attempt patients or members of a health plan to whom we have witnessed that they have got an immediate care need. We never tried to go for that particular philosophy that, prevention is better than cure, right? And that is where I definitely feel that, transformative technology like AI, which today stands in trade-off of, quality, access, and care, absolutely has fantastic things to do. But the more important aspect of it is data, as Dr. Grasso mentioned, that NTT Data Services, we do a lot of work into healthcare space and especially into data and intelligence. And it's our vision that we understand and we try to communicate that data and intelligence is the center of everything. Because we have so much of data today. You talk about structured, unstructured, graphics, spatial data, patient-generated data. With all the data, you can derive meaningful intelligence. And through this meaningful intelligence, it's not only about predicting your future, but it's more about prescribing it. So we try to develop solutions which can help you to generate next best actions and guide those members as well as patients who are in need as well as who want to be protected for their future through right directions. And that is why AI technology like chatbots or virtual agents who can become an interface to those members to guide them better absolutely is priceless. So that's what my perspective is so far with this particular journey that we are taking into the healthcare IT space, and with data and AI being a perfect merge.
Thank you. Merin, would you like to make a comment?
Sure.
And then we'll talk a little more.
Okay, thank you. So 30% of the healthcare cost goes towards the administrative charges. That's a big number. So in healthcare, administrative tasks is scheduling an appointment, billing and collections, patients' referrals, processing of patients' referrals, or pre-authorization. All of this is the back office function that is consuming the cost of the healthcare. I'm sure all of you use a health system that has a patient portal. That patient portal is not even real time. When you request an appointment or ask for your medication refill, that is being processed by a clinical staff when they do have time, right? God forbid, if you run out of your medication on a Friday night and ask for it, that medication refill is not getting processed until Monday morning when the staff is becoming available. So I'm hoping that, and we did a pilot with IPSoft for for our call center, where Amelia was able to process all the calls that came in. It needs to have the emotional and the cognitive intelligence. In our organization, Westmed, we are a privately owned physician group practice with 500 providers. For 500 providers, there's over 10,000 set of rules for the call center staff to know how to take care of a call that's coming in. So we definitely need something like Amelia to process those calls and make sure that the right thing is getting done. So for example, if a patient happens to call, they want to do a sick visit versus an annual visit. It needs to be triaged completely differently, right? A sick visit means that you can't offer an appointment a month from now versus a physical. It could wait for a period of time. So that's where I definitely want to see more and more AI being used in that space. Another area that definitely could use AI is in the exam room. All of us as patients, I'm sure we've been to see the doctor. How much time did the doctor actually spend talking to you versus fetching for information in their computer or documenting the visit? The EMR, today's EMR is created for billing purposes, right? They are spending a fair amount of time just documenting that visit. If AI could surface the right information about that patient and also document document that visit back into the system, that is more time the physician could provide patient care. These are some of the areas I definitely think that AI could make a big difference in the healthcare space.
I'd like to comment on that. Monday, I saw about 30 patients in our clinic in about a 12-hour span. Some of them were lab checks, some were new patients, some were follow-ups. And I've analyzed about 500 patients I've seen in about a month and a half span. And at least 2 hours of that day could have been eliminated through very simple data acquisition exercises. I spend a lot of time trying to gather data so I can act intelligent when I speak to the patient. In many instances, patients see different doctors, and then they explain the same thing 5 times to 5 different people, right? That's very frustrating. So this is happening all the time, and we're living it.
Yeah.
That's why it's exciting to try to solve some of these problems.
Which turns into physician burnout, right?
Absolutely.
Yeah.
Thank you. Kathleen?
Yeah, obviously McKesson's goal is to find ways to use technology to improve the patient care as well as the outcome for those patients. So just 2 brief use cases today that we're building with IPSoft. The first, hopefully, God willing, will go live in the next month or so. One of our call centers, specifically around specialty, takes over 2 million calls per year, specifically around your specialty copay. And although that sounds like a very boring use case, if you're a patient, speed to therapy is very important, especially for some of the therapies, HIV, TB, a lot that we cover. So those are very important. It's very complex from patient perspective. They may have their therapy covered under their medical, or they may have it covered under their pharmacy plan. It's very confusing for patients. So today, our call center, as mentioned, takes about 2 million calls. There are about 300 variables on what the actual patient may be able to ask. So using Amelia, our goal is to be able to answer 90+% of those calls and take that staff and move them up to do more white glove treatment for our patients and be able to provide the service that we don't today. Also in the specialty space, the other use case that we're building out, it's more of a user story today. As mentioned also in our specialty space, adherence is big from a therapy perspective. We need to make sure that the patients stay on these therapies. A lot of them are very expensive, upward of $10,000 a month for some of these drugs. And if the patients go off, don't take them on time, there may or may not be another therapy that we can actually put the patient on to cure their illness. So adherence today can actually be a revenue generator for us. We don't have the staff to constantly call and follow up with the patients. So we're also excited about this one, not only from a patient care perspective, but versus some of the other IP Soft Amelia projects we're working on, which are more cost cutting. This one will definitely generate revenue for our organization and obviously have better outcome for our patients by following up with them. So we're super excited to be working with IP Soft in both these use cases.
You know, we have a little checkbox in our EMR, electronic medical record, that you have to check to do medical reconciliation of drugs. So we have patients with 12 or 15 medications, and I have to spend time. Are you taking them? Which ones? I don't understand. I don't understand when to take this one, not take that one. It's a big problem, medication, compliance. So you see it in your space, how helpful this would be. Fantastic. Thank you. Andrew, any ideas about your work down in your neck of the woods?
Probably not a good idea to say no. Yeah, look, first I should note we're a different type of business. We're a not-for-profit organisation and we're driven by a single purpose, which is to help people with a disability live a great life. And so we look at value and the potential value of AI somewhat differently. Anything that furthers our purpose delivers value. And then secondly, anything that helps ensure our ongoing financial and organisational sustainability is also delivering value. And it's early days, as I think it is for most of us, but our strong hypothesis is that AI is going to deliver value across both those dimensions. So firstly, there's great potential for AI to streamline how we do business and improve the quality of support we provide to people with disability. We employ thousands of support workers in a very distributed model. Most of that is in-home. Now, many of our support workers aren't comfortable with computers and they may or may not have English as a first language. There's frankly no way they can be across all of our policy and procedures and forms. Over time, we believe that AI will break down language and systems barriers, help us, and this one is really important, we talked about data before, but help us build a much deeper and more accurate understanding of each individual customer through natural language and other tools capturing data much more effectively and completely and efficiently. We do think it'll help us evolve our support practices, help us apply those evolved support practices more consistently across a very diverse organisation, increase compliance and lower supervisory costs, which is very important for financial sustainability. So there's a whole lot we see as potential and we're experimenting and learning. I think secondly, and way more excitingly, we see AI coupled with other emergent technologies such as augmented reality, robotics, possibly biomedical engineering, make organisations like us much less needed and possibly in the long term even redundant, which would be fantastic. So just as today a person with a physical disability uses a wheelchair to get around, then potentially in the future a person with an intellectual impairment may supplement or offset their intellectual impairment with artificial intelligence, which would make them much less dependent on support organisations such as us. So I guess in summary, we see AI having potential impact in two broad ways. Firstly, equipping us as an organisation and our staff to serve and support people with a disability better and more cost effectively. And secondly, equipping people with a disability directly with the tools they need to improve their autonomy, their well-being and their social inclusion and their social contribution. So very excited about the future and we're out there learning about it now.
That's fantastic. We have in our practice about 75% of our patients only speak Spanish and maybe 5% of them actually finished high school. And many of them have mental impairments, dementia, early stage Alzheimer's, the sequelae of strokes. It's very difficult to design tools and implement sophisticated technologies in that ecosystem. But what's interesting on a use case that we were working on for the dementia population, some people will ask you the same question when they're home 5,000 times. And you can't afford people to come and answer the same question all the time. But someone like Amelia that could be positioned to very happily answer the same question 10,000 times isn't really a problem. And it does solve demand in that instance. So I believe there's going to be a whole range of complexities, simple to complex, that gets stitched together. We spoke yesterday, we had a nice conversation. Do you see the redesign of the re-engineering of the workflow that this may empower to streamline the organization as it moves forward?
Yeah, potentially. I think we all have to be honest and say the crystal ball is still a little bit cloudy. We're at early stages of experimentation and trials. For us, our shorter term focus is on equipping and powering the humans at the very front line, who are the support workers who interface every day in all types of ways with people with disability. And so it's a bit of a different model to some of the call centre and other type of models where Amelia is dealing directly with the customer. We see that potentially in the medium to longer term, but right now we're looking to enable and empower our frontline human beings to do their jobs better.
Fantastic. I think in concluding, we're hearing that delivering these types of solutions into the healthcare vertical is complex, linguistically, from the clinical perspective, from the deployment perspective. But we will need a greater number of workforce agents. It's very difficult to spin up and hire all these people. And I think you'll see how companies such as ours together come up with innovative solutions that meet demands. Do you have a comment?
Yeah, I just want to highlight one thing. I mean, this is one of the use cases that I and Dr. Grasso have been discussing for some time now. We have, entity data working with Amelia, IPsoft, and implementing Amelia in various projects. Have seen a lot of operational gains and efficiencies. But coming from a clinical background, both of us started thinking about that. Can AI or virtual agent like Amelia be used in some more in-depth clinical area? For example, in doing care management, member management. Not only about helping them to schedule their doctors, prescription refills, but do much more intellectual conversation with the member from a clinical perspective. I'll give you an example over here, a type of use case that we wanted to work out, and we are actually talking with a couple of our large health plan systems, is what if there is a member or a patient who has got all the diabetic medicine properly been taken, the prescriptions are well refilled, the visits are proper, everything is good, but still it shows that the numbers are not to that level which is expected. It's not coming down to the normal. What's the problem? Now, how to manage a patient like this? Obviously, you need to do an outreach, a health education, but is it possible to do it across the mass? So that is where we are bringing in, data intelligence by churning data along with the patient clinical information, demographic, financial information, images, whatever is available within that health plan ecosystem, as well as churning it along with social determinants of health, which is an absolute guide. And what we could find from there is probably that particular member resides in an area where he or she have to live up for a Burger King. That is exactly probably is causing a problem with the dietary, the meals that they're taking, which is impacting the numbers. And that is where, AI technology like Amelia, which can gain this intelligence from the back-end data lake and try to converse with the member and say that, hey, we understand you are having challenges. Can I suggest you where to pick up the right food? Can I find food for you? Can I help you to schedule an Uber Eat delivery system? So this is something, a different thought process. And when we are talking to the health plan, they are absolutely liking it, because now we are talking about the concept is more of like this: take the robot out of the human and let the human do the human task. So some of the things can be easily been communicated by an AI technology like this at the first phase, and when there is an escalation need, it goes back to the real agent who understand the severity of that particular incident, how the member has to be managed. So this is something that we are trying to think, moving the AI application from an operational to the core domain healthcare, or I would say a clinical area.
Thank you. Well, thanks for that summary. We're out of time on our panel. We'll be around. We'd like to talk to you during the day. Hopefully you all can see us in the back. And this concludes our healthcare panel. Thank you. Thank you.
Thank you.
Great.